and thank you for joining us on another edition of Welbodi. Welbodi is a health magazine produced by West Africa Democracy Radio 94.9 FM, Dakar. And I am your host, Oge Obierika. Today on the program,
I had no broad knowledge about women's sexual and reproductive health until I got married and was faced with childbirth and some other related issues. Infections that I had after my first and second miscarriages.
I'm very sensitive when it comes to females and their reproductive health. Even in my house, we don't stand and pee on the toilet at all to sit because there are ladies in the house. Any little thing, they can catch infection.
I didn't have full knowledge as to how to be safe down there. I would want to wear anything, not thinking that it could compromise my health in any way.
We look at critical issues surrounding women's sexual and reproductive health needs and rights, and how men and women perceive them.
Health is a woman's profession, and what we're asking for is that women have an equal say in leadership in health at all levels, from community health workers right up to the global level that we're dealing with. And when we look at the figures, although women are 70% of the health workforce, they hold only 25% of decision-making posts.
We also bring you an expert's view on the representation of women at the World Health Assembly and how it impacts women's access to healthcare services. Stay tuned. A warm welcome to you tuning in from Liberia, Ghana, Nigeria, the Gambia, and Sierra Leone. Thank you for joining us via our partner stations in your country. On Welbodi, we bring to the fore health issues in the sub-region, developments across the board, and personal health matters so that you are able to make the right choices for your health. As I mentioned earlier, today we will be discussing women's sexual and reproductive health issues. Now, globally, there is a regression in the progress of women's rights protection, increased rates of domestic violence, and amplified poverty in women. Pregnancy and childbirth, compounded by gender inequalities, expose women and adolescent girls especially to sexual and reproductive health risks. A 2019 report by the World Health Organization showed that maternal health conditions such as sepsis or obstructed labor were the second leading cause of death among girls aged 15 to 19. According to the same source, in Sub-Saharan Africa, the region with the highest adolescent birth, 1 out of 10 girls aged 15 to 19 give birth, and only 1 in 4 adolescent girls have their needs for family planning satisfied by modern methods. When it comes to making decisions about their own sexual and reproductive health, less than 50% of married adolescent girls make informed decisions regarding sexual relations, contraceptive use, and reproductive health. In Nigeria, Mali, and Senegal, 1 in 10 or fewer adolescent girls do. Sankule Janko brings us a report from the Gambia where female genital mutilation FGM is one of the major reproductive health problems faced by women in the country.
For years, FGM had been a deeply entrenched cultural practice in the Gambia, affecting countless young girls and women, according to reports. Despite the anti-FGM law enacted in 2015, enforcement had been inconsistent and the harmful practice persisted in many communities. The conversation on the polarized topic sparked another public debate when Almame Jiba, the National Assembly member for Foni Kansala, introduced a private member bill to repeal the anti-FGM law which criminalizes the practice. The CSOs, representing a coalition of health advocates, human rights defenders, and women's groups, were determined to change this as they continue to present their position papers before the National Assembly's Health Committee. Jaha Tukure, a prominent activist and survivor of FGM, presented her foundation, Safe Hand for Girls, position paper before the National Assembly Health Committee.
As a human race, we have seen the impacts that this has on women. I have a sister that died from going through FGM, and that is not a lie. When she was subjected to FGM, when she was 1 week old, she bled. And this is the reality for many people. And we're not saying that everyone that goes through FGM dies, because I went through FGM and I'm sitting here. I spoke to religious leaders in Egypt, in Saudi Arabia, across the Muslim world. And I realized that there's no concrete evidence that female genital mutilation is obligatory in our religion.
For decades now, the Gambia Committee on Traditional Practice, GAMCOTRAP, has been championing the advocacy against female genital mutilation. Presenting its position paper before the Health Committee was Gambia's former Vice President and renowned gender advocate, Dr. Aissatou Toure.
This submission seeks to call for maintaining the law protecting women and girls from female genital mutilation and to contribute to informed decision-making and promote the protection of human rights, gender equality, and the well-being of all citizens, particularly women and girls in the Gambia.
FGM is considered a human rights violation in most parts of the world. Against this backdrop, the National Human Rights Commission of the Gambia has a clear stand on the subject matter. Emmanuel Dijuv is the chairperson of the National Human Rights Commission of the Gambia.
The Women's Amendment Act of 2015, which has been in operation since 2015, and this is what is sought to be repealed. I think this is where we are. And as an institution, we have said it is a dangerous route to take. But just to say that the 2015 Act came into existence after a long struggle of civil society, reports from WHO, reports from UNICEF, but also the Gambia ratifying international treaties and conventions like the CEDAW, the Convention on Elimination of Discrimination of All Forms Against Women, which we have ratified, especially the Maputo Protocol. This is under the African Charter on Human and People's Rights, but this particular protocol deals with the welfare and health of women. We classify FGM, all forms of FGM, as a violation of human rights. It obligates all the states to eradicate it.
Thankfully, Gambia's parliament on July 15, 2024, voted to uphold a landmark law that bans female genital mutilation in the country. MP Amadou Kamara, who chairs a joint health gender committee that recommended the FGM should remain outlawed, says none of the clauses seeking the repeal of the ban in the Women's Amendment Bill 2024 was passed.
Sankule Janko with that report. This brings us to the question, what are men's perceptions of sexual and reproductive health issues that women face? Let's head to the street to find out.
I know of fibroid, I know of ovarian cyst, I know of pelvic inflammatory disease. My mom, at the time she had the fibroid, I was very little, but I saw the impact it had on her and the pain. It also came at the time she was battling marital issue. It really had a great impact. I have female friends and they tell me a lot about the things they go through. So I'm very sensitive when it comes to females and their reproductive health, because I've grown to understand that what a man will do and get away with, a woman might likely get affected health-wise. Even in my house, we don't stand and pee on the toilet at all to sit, because there are ladies in the house. Any little thing, they can catch infection. So we sit. So it's become a habit. I think the awareness is there, but the acceptance is a problem, especially on the part of the men. Recently, I've been seeing conversation about menstrual cycle and how it affects the behavior of a woman. And some of the comments that I read, I found myself asking, are these the kind of men our daughters are going to end up with?
I know of fibroid, I know of cervical cancer, I know of breast cancer. But breast cancer I know because an aunt of mine had it and she died of it eventually. I also know of infertility because an aunt of mine, again, who has been married for more than 10 years, is unable to have a child, for which reason her husband has gone to marry another woman, albeit the first wife is still in the marriage. So I know of these two because of relations of mine who have had them. Well, when it comes to issues about reproductive and sexual health, I rarely talk to women about it because I know some women go through, even for my aunt who hasn't been able to have a child for over 10 years, I have never asked her that question because I know these are very sensitive topics. I think that women, their sexual rights are protected so much because some time ago my father had issues relating to male reproductive health. And until I went to the hospital, I didn't know anything about what he was suffering. But for women, I've heard of breast cancer awareness, I've heard of cervical cancer awareness, fibroid, and all of that. So I think compared to the male counterparts, men are up there.
Female genital mutilation or cutting, menstrual problems, some encounter pain during menses. Women also suffer from fertility issues. They also have pregnancy issues, or either wanted or unwanted pregnancies. Equally, they suffer from sexually transmitted infections, sexual violences, uterine fibroids. Knowing this has really impacted my relationship with the opposite gender, that is women, because it made me to understand women undergo so much social stresses and psychosocial issues. This has made me to be very, very careful with women. Well, I don't think women's sexual and reproductive health rights are protected 100%. Or at least there has been a lot of progress, but I think more needs to be done.
There are a whole lot of sexual and reproductive health issues that women deal with: sexual violence, pregnancy, monthly periods, HIV and AIDS, menopause and the likes. Some of this will learn from school, but most of them will learn them naturally. I don't think women are actually being protected or respected, because if they are actually being respected, there should be proper ways of handling things like this to make them feel more safe. Take, for instance, monthly periods are natural, right? So why is it so hard for governments to provide free pads for ladies to take care of themselves?
In primary education, there was a subject called Population and Family Life Education, where sexual and reproductive health is treated. When it comes to the issues that women deal with, I know this too. How I act and how I behave towards women actually changed because I was able to know more and then act accordingly without causing any discrimination or negative perceptions towards the women that I know. It has also helped me become an advocate in my own right as a nurse, where I will give advice to women, because in as much as being in the opposite gender, but then or sex, it is still some sort of a taboo even within the women themselves. So the little knowledge that I know has helped me to be able to help them.
You just heard the opinions of some men on women's sexual and reproductive health issues. If you're just joining us, this is Welbodi, brought to you on West Africa Democracy Radio 94.9 FM, Dakar, Senegal. Welbodi also airs in Liberia via Alternative Youth Radio 98.9 FM, Lofa County. Voice of Liberia FM 104.1 in Monrovia, Voice of Liberia FM 89.7 in Kakata, Magibi County, and Kwaketa Radio 100.9 FM, Banga. Ghana via Royals FM 104.7 Wenchi and Pod 95.1 FM, Savannah Region. Nigeria on Albaka Radio 97.5 FM Bauchi and Darling FM 107.3 FM Owerri, South East Nigeria. If you are in the Gambia, you can tune in on Hot 104.3 FM and Numi FM 94.0 FM North Bank region, and in Sierra Leone via African Young Voices 101.6 FM Freetown and Radio Gbaft FM 91.3 Malwan. We have been talking about issues that concern women's sexual and reproductive health and rights. Just in case you missed the earlier part of the program, please listen again on WADR.org or visit our page on Audiomack and SoundCloud. While religious and cultural views do exert powerful influences on how people look at the importance of women's reproductive health, lack of education, media bias, and social stigma are among the leading factors as to why men appear to have such restrictive knowledge about the way women's bodies work. But what about the women folk? How much awareness do they have about these issues? Let's find out.
I've had to deal with fibroids and ovarian cysts. I had my first surgery in 2019, and then it came back sometime last year. So far, I'm trying to eat very healthy. I'm trying to work out because my doctor said if you eat healthy, if you work out, if you live a very healthy life naturally, it might reduce the growth. And then secondly, getting pregnant can actually help in shrinking it. Then the ovarian cysts, there are drugs, antibiotics that might melt it, or you can manage the pain. Yes, I received support from my family and my friends. I don't really have too much male friends, but the few I have, they've been quite supportive. They may not fully understand what you're going through because, they are men, but some even take out their time to read about it, They've been quite supportive.
Growing up, I always found it so tedious. For some reason, I could not properly calculate when I'm ovulating, what is happening to my body, what changes I should expect. Because I realized that for me, it wasn't something that would stick. So maybe this month I'm feeling this way, and so the next month it should be consistent. I realized my body was changing depending on what I was eating, how I was feeling. I was having breakouts at the time in the past, and so I was very confused what was happening to my body. But through friends again and the app that I was using, I got to understand that when you're a woman, of course, you should know when you're ovulating, especially if you're sexually active, for instance. There's still more that stakeholders need to do. For instance, if you look at what is happening in the United States, but now they say the world is a global village, so something that is happening to a female in the United States can, in its own way, affect me here. And if you look at what is happening in the United States, there's ban on abortions and all that. I feel that a woman, you know what is happening to your body. You should have the right to decide what you want to do with your body. If you are at a stage or at an age that you can mentally and physically maybe we use 18, so maybe 16 from 18 years. But I feel like Ghana is still developing when it comes to even understanding what makes up sexual and reproductive health. If we don't even understand that clearly, how then can we protect these rights?
Long time ago, I've had infections despite practicing good hygiene. I booked straight away an appointment with a gynecologist who prescribed me a treatment, and it was due to certain hygienic products I was using. Plus, the quality of the material of my underwears wasn't the most appropriate, she said. But I just followed the gynecologist's indications and stopped wearing both nylon and tight underpants, as well as using artificial hygienic products. We generally don't have these talks with families, maybe with friends, because in this society, sexual matters are often considered taboo. And in Senegal, when it comes to sexual and reproductive health, the state is quite liberal. Now, what needs nonetheless to be pointed out is the lack of information regarding these issues for many women, and a deficit of healthcare programs dedicated to it.
I had no broad knowledge about women's sexual and reproductive health until I got married and was faced with childbirth and some other related issues. Infections that I had after my first and second miscarriages. After some series of diagnoses, it was discovered I had pelvic inflammatory disease, PID. Well, I received adequate medical treatments immediately from various hospitals anyway, because it was not easy to heal from that infection. Whether my sexual and reproductive health rights are protected and respected, I'll say yes, because it's a matter of choice. You just have to choose the number of children you wish to have, how you wish to space them.
I didn't have foreknowledge as to how to be safe down there. I would want to wear anything just because I felt comfortable with it, not thinking that it could compromise my health in any way. I started off by doing a personal research because unfortunately in this part of town, issues surrounding sexual and reproductive health are not widely discussed. Till now, I'm not even comfortable discussing certain issues that I have. So I'd rather go on a personal journey, do a research. If I enter my symptoms and it looks too dangerous, I think I may want to resort to the hospital because that would provide me a more safer solution. Like I said, it's not something that we are really comfortable talking about. I think that there's still more room for improvement because we seem to take a lot of things for granted. So we definitely have a long way to go.
Those were the voices of some women on sexual and reproductive health issues they have had to deal with. A lack of autonomy to make decisions about one's reproductive health care, financial limitations, restricted access to services, and power differentials between healthcare providers and recipients are factors that may impede women and girls from exercising their reproductive rights. Adding to this plight is the underrepresentation of women in decisions affecting their health and its access. However, a report by Women in Global Health showed an increase of 9% in the number of women occupying chief delegate positions at the World Health Assembly, bringing their overall representation in decision-making to 32%. Will this be a game changer for women and girls regarding their access to healthcare services? Let's take the conversation further as we speak to Anne Killing, a senior fellow at Women in Global Health.
So the progress that we have is just one small step forward, but I wouldn't say that it gets us very farther towards our goal of gender equity in health leadership. So a small step, but I'm not sure that I would say this is major progress. So when we look at the figures, 32%, that's just under a third, of the over 190 delegations that come from member states to the World Health Assembly are headed by women. And that is only up 1% on 2017. So when we look at this, there was a dip during the pandemic and we've come back up just about pre-pandemic level, but we're still only at 1/3.
We know that Global Health pushes for women's health and gender equity. How will the significant representation of women in health leadership positions impact this cause?
Yeah, so let me start by saying that 70% of health workers are women and over 80% of nurses, midwives and community health workers. So health is a woman's profession. And what we're asking for is that women have an equal say in leadership in health at all levels, from community health workers right up to the global level that we're dealing with. And when we look at the figures, although women are 70% of the health workforce, they hold only 25% of decision-making posts. So women are falling behind. So we're arguing for gender parity. We want equal numbers of men and women in leadership. But beyond that, we want all leaders to be diverse. Because what we find looking at the numbers is that women from lower middle income countries are particularly underrepresented. What we're saying is we don't want just any men and women. It's not enough to just get 50-50. It's also about those men and women in leadership being representative of the people that they're supposed to represent. So we definitely want to see, greater percentage of women from lower middle income countries.
Do you think that higher representation of women in various spheres would increase the chances of more women and girls exercising their rights and potential to be healthy?
So we would say that equal representation in leadership is the first step. But that's why we talk about gender transformational leadership, because all leaders, whatever their gender, need to be addressing the gender inequalities in the health service. They need to be looking at the health service and saying, who doesn't have access? And if they don't have access, how are we going to increase the access for those people? In some cases, it may be men who don't turn up when they could turn up when they're ill. There's maybe a stigma in some places about men admitting illness, particularly mental illness, and so they don't come forward for treatment. It may be that it's actually, men who are underrepresented in accessing services. It could be women. But we need to be looking at the gender dynamics of all of it. Can women get to the services? There may be 100 different reasons that we find in our research why women can't access services they can't pay, but there may also be other reasons why men can't access services. And that's why we talk about gender, because we need to be looking at the gender dimensions of this to see, who needs special action to make sure that they do have access.
What are your recommendations for addressing this historic underrepresentation of women in the World Health Assembly delegation?
There are 190 or so countries, and each of them decide individually who they're going to send. So WHO writes all countries before the WHO, and they ask them to bring gender-balanced delegations. But clearly we see from the figures that doesn't always happen. So the WHO can encourage, but it's actually down at the country level that the decision is made. And I think that's where organisations like Women in Global Health come in. That civil society, when they know, for example, there has never been a woman chief delegate from their own country, and civil society should be lobbying their health ministry to say, why is this? This is embarrassing for us. now let's change this for next year. So I think we would see action at a global level, but also very much at a national level as well. It's not just a women's issue, it's absolutely everybody's issue.
That was Anne Killeen, a senior fellow at Women in Global Health. And this is where we wrap up this edition of Welbodi. Many thanks to you for listening, and special regards to my resource persons as well as my colleagues for their contributions. For your feedback on the program, email us at wadr.org. Until next time, keep staying healthy. I am Oge Obierika.